So today we are going to deal with the ophthalmology instruments, and my purpose to deal with the ophthalmology instruments are dual. Like you know that so many times in the practicals and the viva these instruments are kept, and you have been asked to identify the instruments and you have to tell its uses. But the second reason why I want to discuss the instruments is that while you are going through the theory of ophthalmology, there are so many procedures that you study, there are so many steps that you are studying, so it becomes slightly cumbersome to understand those surgeries or to understand those steps until and unless you have the sound knowledge of the instruments. So let's begin with the first one. So in the first one, I am beginning with the very basic instrument, and that is one instrument that you use a maximum of the times. So can you see this? What is this actually? This instrument is a universal speculum. It is called as the speculum. Now the reason why it is called as universal, because you know when we use other speculums we have to use separate, like we have to use separate for the right eye, separate for the left eye, but this speculum can be used in the either eye. So that is why it is called as universal speculum. And what is the actual purpose of the speculum is to widen the eye. You have to open the eye so that you can do the procedures. So this can be used for the very basic when you are doing the enucleation surgery, the evisceration surgery, the destructive procedures. Then a very common thing that you see in the OPDs, that you have to remove a foreign body. Now what happens when there is a foreign body, maybe in the conjunctiva or in the cornea? Obviously there is lot of lacrimation, lot of redness, congestion, patient is in pain. So it becomes difficult for the patient to open his eye wide and let you remove that foreign body. So for that purpose we also require the eye speculum at the time of removing the foreign bodies. And I think this is one of the very common uses of this speculum, because every day when you are there in the OPD, I think there must be some patients, and everybody who is posted in the OPDs or who has already passed or maybe doing the internship posting in the opthal will agree to me that like foreign body is one very common case that you get in the opthal OPDs. So that time also we use it. Then third thing, another important thing is the corneal ulcers. Like we have got a lot of cases of the corneal ulcer, especially the bacterial ulcers. So at that time also, when we want to do the cauterization of the ulcers, we want to remove this corneal debris, then also we use these via speculums. Okay, so first of all, let's go through it. It is a universal speculum, can be used for both the eyes, and it is used to separate the eyelids when you are going under, your patient is undergoing any intraocular surgery. One very important advantage of the speculum is that it is self-retaining. Otherwise, you have to get hold of some person, a person assisting you, you actually will hold this. So it's self-retaining, so you independently can do it, and it's very lightweight. So patient compliance is again very good. So whenever you are doing any intraocular surgery, extraocular surgeries, you require this speculum. So that is the purpose I started with this, because the moment you are into the procedures, whether it's in the OPD or whether it's in the OT, you have to know this. Alright. So this was your first one.